Hello everyone and welcome to Lung and Sleep. My name is Leah and I'm the practice manager at Lung and Sleep. This is one of our first GP education events that we've hosted through Lung and Sleep, and I think after a really crazy 2020 for the entire world, we hoped to try and give a little bit back to our patients and our broader community by providing some online education. So what I will do is hand you over to our Director of Lung and Sleep, Dr. Barton Jennings, who will take you through a presentation this evening. Thanks,
Excellent.
Barton.
Thank you very much, Leah. And good evening and welcome to Lung and Sleep. And as the first online event for our doctors. And what a big year it's been in healthcare. It's certainly been a very difficult time for everybody with the lockdowns due to COVID. Working in healthcare has certainly been a real challenge. And I suspect that many of you may not even have had a holiday since the start of the year. You know, working from home, adjusting to telehealth, homeschooling, it's been a difficult juggle. COVID restrictions and the PPE requirements of us has made work for us, really logistically difficult too. But in our practice Lung and Sleep, I've been really grateful that our team and I have been able to continue to work throughout this time. And also really grateful to be able to have helped people cope a little bit better during this difficult time. And having chatted to a lot of patients in the clinic and also on Zoom, it became clear that most people were struggling with, to some degree, with the isolation, the inability to see family, needing to wear masks. And sleep is something that's been really adversely affected for many. And I suspect not just our patients, but probably ourselves as well. And I know certainly myself has had difficulty at times during this year, more so than usual, with sleep. So I thought it was useful tonight to talk about sleep and discuss a bit of an approach to improving sleep. So I want to thank everyone for attending tonight. It's very exciting. I've been looking forward to this and I hope you'll get something out of it. It would be good to make this as interactive as possible. We've got the chat there, and I'm sure everyone's familiar now with Zoom chat. So I'd really encourage you to use the chat and to put questions in. If you put questions in, I'll keep a bit of an eye on them because I've got my other screen here. So I'm going to keep an eye on the questions in the chat, and as we go. If you have a question that you want to ask in person, you can just put the word question in there, and then we'll unmute you and we'll come to you and you can ask in person. Otherwise, just type the question in. But maybe just to get everybody used to the chat, if you open up the chat on your computer, and let's just take a quick poll of people and ask everyone, when was the last time you actually went away on holiday? Maybe just put the date in of the month, put the month in of the last time you went on holiday. So I suspect for many of us, it's probably been some time. With the inability to get out of Melbourne for a lot of the year, those in rural Victoria may have had an opportunity to travel a little bit around Victoria, but certainly in Melbourne, it's been very difficult to get out, and to get into state's been very difficult. So mostly January, a couple of days in November, so just very recently, so that's good. People, as soon as lockdown is lifted, it's nice to see that people are getting away immediately. January, March, February, Japan, wow. So a lot of people sort of got back in February, and you think back to that time, you think, wow, like if you're away for much longer, then could have even been not able to get back. Canada in June, that's a good effort. And so, as I said, we're going to talk about sleep, and in particular ways in which we can improve our sleep. So this is our team. This is during the time when we weren't able to have photographers come and visit us. I set up some photos of us in our rooms, and since we've at Bentley Special Centre, but since then we've had a few team members join us. Kyle on the bottom is our new lung function scientist who recently graduated, so it's very exciting to have him, and we're going to be doing some lung function testing, and we also have 2 secretarial staff who are working off-site, so couldn't be in Bentley Special Centre for the photo. And this is just to demonstrate that we've been very COVID safe, and that's been important, obviously, and allowed us to stay open during this time as well. And I just wanted to show everyone my YouTube channel. I've got lots of videos on my YouTube channel. If anybody's interested, I recommend that you jump on. You can get onto YouTube, or maybe Leah could put into the chat the address there. But if you search lung and sleep, you'll be able to find that. And there are lots of really interesting videos on sleep and respiratory and lung disease and bronchoscopy cases and things like that. But so tonight we're going to talk about sleep. And so I wanted to start off with this short grab of Seinfeld, because Seinfeld's definitely one of my favorite shows. I think it's probably one of everybody's favorite shows. Probably, I think, one of the best comedies ever. And this was a fantastic episode where Kramer was reading about Leonardo da Vinci only sleeping for 20 minutes every 3 hours. And this was going to be fantastic because it gave him 2.5 extra days in the week. And that meant that if he lived to the age of 80, that would be the equivalent of living to 105. However, it didn't end so well because he found that he couldn't stay awake, and that got him into obvious trouble. But for some time, people sort of think of sleep as maybe a sign of weakness. And everyone's heard the saying, well, you can sleep when you're dead. Maybe it's wasted time, maybe it's dead time. However, the reality is that a lack of sleep increases our mortality. And interestingly, there is a global experiment on 1.6 billion people across 70 countries that occurs twice every year. And it's daylight saving. And in spring, when we go into daylight saving and we essentially lose 1 hour of sleep, there's a 24% increase in heart attack. And in autumn, when we gain that extra hour of sleep back, there's actually a 21% reduction in heart attack. And this is shown quite consistently every year. And we see the same effect with road accidents, poor mood, and also suicide. Sleep also has a very strong effect on immune function. And a lack of sleep increases the risk of breast, bowel, and also prostate cancer, and probably other cancers as well. But we have evidence for those ones. There's also a risk of Alzheimer's disease. So sleep is not a luxury. Sleep is a biological necessity. And so that means we need to think about, well, what is normal sleep? What should we be aiming for, and what should we be trying to achieve? And we could talk about normal sleep in terms of quantity of sleep, so the duration of sleep. There's probably no exact number in terms of how long we should sleep, the magic 8 hours. It's probably a little bit individual, but it's probably longer than what a lot of people think. And it's probably somewhere between the 7.5 and 9 hours, depending on how much sleep you need to be able to get through the whole day without feeling sleepy. We can also talk about the quality of sleep, and we talk about sleep architecture in terms of how the sleep is made up, of what stages, and do we transition across into different stages of sleep normally without arousal, where arousal means a brief awakening from sleep. So when we're looking at the EEG, if you're going from sleep to wake back to sleep, then that's an arousal. And if that happens quickly, you may not remember it happening. But if there's a lot of quick arousals throughout the night, then it affects the quality of sleep. And we should have a short sleep latency. So when we go to bed and plan to go to sleep, we should fall asleep within 20 minutes. We should be able to maintain sleep. So we shouldn't really wake up throughout the night. So obviously in the optimal perfect world, you'd go to bed, fall asleep within 20 minutes, wake up, a minute before your alarm. That doesn't usually happen, but we should be able to maintain sleep throughout most of the night. And if we do wake up, we should be able to go back to sleep. If we have difficulty getting to sleep initially, that's what we call onset insomnia. If we have difficulty where we wake up and then can't get back to sleep and spend time during the night asleep, that's what we call maintenance insomnia. We should maintain stable breathing throughout sleep, and so we should maintain our oxygen levels normal throughout sleep. And when we wake up in the morning, we should feel refreshed and alert. When we first wake up, there's always a little bit of sleep inertia. So you wake up and you might feel a little bit groggy for a while. But after 10 minutes or so of getting up and getting out of bed, we should feel awake, and we should not feel within the first few hours of being awake that we could go back to sleep. And we should be able to get through the day without sleepiness. Our circadian rhythm always has a little bit of a dip in the afternoon, and that's why often people get a bit sleepy in the afternoon, and a little bit of sleepiness is normal. But we shouldn't feel like we're going to fall asleep, and we shouldn't feel like we need a nap in the afternoon. And that dip in our circadian rhythm in the afternoon is normal, and that's why some European countries like Spain will have a siesta in the afternoon where they actually give into their natural circadian rhythm. However, our lifestyle has evolved in a way that we don't do that. So that's all what we should be trying to achieve, but so how are we going to achieve it? And I think that I like to break it down into 3 different parts. I think what we need to do is we need to optimize our sleep quality. So to make sure that when we are asleep, that we're getting the most benefit from the sleep, we're getting good quality sleep. We should maintain our body clock, which is our circadian rhythm. And if our circadian rhythm is out of sync, it's going to make it difficult for us to sleep. So we want our circadian rhythm to line up to when we want to sleep. And we want to cultivate good sleeping habits. And so these all play a role together because our sleep quality needs to be optimized. To optimize our sleep quality, we need good sleeping habits. We need to have an aligned body clock, and we need all of these working in sync to be able to achieve normal or optimized sleep. So sleep quality, I think, is the first thing to talk about. And because if sleep quality is suboptimal, then it doesn't matter if you get the other things right. If there's something affecting your sleep quality, then it's going to be difficult for you and you're going to feel sleepy during the day. So what we want to do first is try to make sure that when you are asleep, that your sleep quality is good. And so that's where the sleep study comes into it. And a sleep study will assess quality of sleep, and it will also determine if there's something there that's adversely affecting our quality of sleep. And so this is an example of a sleep study, which looks pretty normal. This is the raw data. So this is what we look through when someone has a sleep study and they have all the monitors put on, measuring their EEG, their heart rate and breathing and oxygen saturations and everything. And this is the readout we get. So across the top line, we have ECG, which obviously tells us about the cardiac rhythm and whether there's any arrhythmia or tachycardia during sleep. The EMG looks at muscle tension. It looks at muscle tension around the jaw, and that tells us a little bit about grinding and bruxism, but also tells us about sleep stage, because in REM sleep, rapid eye movement sleep, we actually lose muscle tone, and we should be able to see that on the EMG. And there's unusual sleep disorders called REM behavior disorder, when people actually act out dreams and act out sometimes quite violently during REM sleep. And it's because they lack that normal atonia of REM sleep. All these squiggly lines are basically EEG, and this is what's used by the sleep scientists really to determine if the patient is asleep or awake. And if they are asleep, what stage of sleep they're in. This is an oxygen trace, which is a nice flat line up in the high 90s, as it should be. This is airflow, so breathing, it's very stable breathing in and out. And movements of the thorax and the abdomen is also very stable breathing, and there's snoring, and that's a nice flat line with no snoring. So this is very nice normal sleep. We also monitor the position that people are in, because often snoring and sleep apnea is worse when people are on their back, because when people are on their back, tongue and jaw fall backwards and obstruct the airway more easily. And this is pointing at, we also monitor the limbs to see if people kick their legs. If there's leg movements during sleep, then sometimes that can actually cause people to have fragmented sleep. Here's another one, and if we just look down to the flow there, we start off with sort of relatively even flow. However, we then come to a time here where there is a reduction in airflow, and it's then followed by a very large increase in airflow until it sort of goes back to normal. Then there's a complete cessation of airflow, and then followed by an increase in airflow. And so this is what happens with obstructive sleep apnea. So when there's a reduction in airflow, we call this a hypopnea, and that's occurring because our upper airway here, which should be held open by muscle as it is during the day so that we can breathe in and out through an open airway, at night time, that airway becomes relaxed and floppy, and that floppiness of the airway is what causes snoring. But if the airway closes enough to slow our breathing, we get a hypopnea. If the airway shuts completely, we get an apnea. And our brain will always detect that. It'll detect the drop in oxygen or the airway closure, and it'll cause us to wake up, open up the airway, take a big breath, and saturate our blood with oxygen. And so here, along here, you can see the oxygen saturation goes along normal, and then as soon as there's a hypopnea, a reduction in breathing, there's a desaturation, and desaturation below 90%. Once the airway is opened up, there's an increase in breathing, quickly resaturate, normal again, but then once again, there's an apnea and there's a drop in oxygen, and you can see that this is occurring frequently or constantly throughout the night. So each time the airway closes or narrows and then opens up again, it causes a brief arousal from sleep. And then the person goes straight back to sleep and the cycle happens again. So people won't remember these brief awakenings, but if they're happening frequently, then it'll affect quality of sleep. And along this line is snoring, and you can see there's a little bit of snoring there. So this is the summary page that we get from a sleep study, and this is probably what most people are more used to seeing from a sleep study. And what this is it's a timeline throughout the night from 9 p.m. Through till 9 a.m. This is what we call the hypnogram. And the hypnogram shows different colors according to different stages of sleep. So when there's no color, there's a little tiny bit of yellow just in there. That's light sleep or stage 1 sleep, just as we're drifting off to sleep. There should only be 5% of the night is made up of stage 1 sleep. The green is stage 2, which is good quality consolidated sleep. The blue down the bottom, which is hard to differentiate from the green, is deep sleep. And the red bar at top of the line is REM sleep, rapid eye movement sleep. This is when we tend to have dreams, and this is when the airway becomes most relaxed because of that loss of muscle tone. We've then got the position that the patient's in, the oxygen saturation along here, and you can see, although there's a bit of artifact, it's a relatively flat line across there. And these are breathing moments of apnea or hypopnea. So HYP is hypopnea, there's obstructive apnea and central apnea. And there's a couple of hypopneas out throughout the night, but not many. And so that's all pretty normal. Along this line are the arousals, so they mark in just a few times throughout the night. They've briefly aroused from sleep, which is normal to happen sometimes, but not if it happens too often. And then this is the summary page, and the main number that we're looking at here is the AHI, and AHI is the apnea hypopnea index, which is the number of times the breathing is slowing down or stopping every hour. And this should be less than 5, which is normal. And so in this case, 1.7 is normal, so suggesting that there's no sleep apnea. Here's another one on the other hand. Here, the first thing that you notice is the hypnogram shows a lot of yellow sleep. So a lot of stage 1 light sleep, and that is because there are arousals occurring constantly throughout the night. And every time you briefly wake up, you have to go back into sleep. You go through stage 1 sleep until you get into good quality sleep. But as soon as you get there, you're being woken up again. And there's the oxygen levels, which you can see is clearly different to the previous case, where they're dipping all the way through the night and really going quite low, below sort of 75 or 60%. And the reason for this is the obstructive apneas, and you can see it's a little bit difficult on the screen, but you can see that there's points along that line constantly suggesting that non-stop throughout the night, the upper airway is obstructing, causing an apnea. And on the summary sheet, the total AHI is 94. And so that is very severe sleep apnea, where usually an AHI of greater than 30 is consistent with severe sleep apnea. And as a matter of fact, I saw someone today who I think has broken the record for me, in that they had an AHI of 136. So sleep quality can be affected by many things, but obstructive sleep apnea is certainly one of the most common and one of the ones that we see very frequently. Restless leg syndrome is when people get discomfort in their legs, and they feel often towards the evening that their legs are becoming uncomfortable, and they feel the need to move them around. Often moving them around relieves that feeling. And the restless legs can sometimes keep people awake, but it can often be associated with a situation called periodic limb movements of sleep. And that's when when they are asleep and they rhythmically kick their legs. And sometimes people are aware of this. Their bed partner might say, they kick and they all the time throughout the night. And sometimes the leg movements can actually cause arousal from sleep and affect sleep quality. Bruxism is grinding of the teeth, and sometimes when people grind their teeth, that can actually wake them up from sleep and cause adversely affect their sleep. Interestingly, bruxism often occurs with obstructive sleep apnea. And if bruxism occurs when there is obstructive sleep apnea, often treating the sleep apnea actually gets rid of the bruxism. Pain, so if patients have anything that causes them pain, chronic pain, that can certainly affect their sleep, as can the medication for the pain. Sometimes getting up to go to the toilet can obviously affect people's sleep. But interestingly, very frequently when people have to get up to go to the toilet at night time, it suggests that there might be obstructive sleep apnea. Because when people have sleep apnea, they actually lack the ability to secrete antidiuretic hormone, which we normally secrete at nighttime to slow down the production of urine. And so in patients with sleep apnea, they stop producing that hormone, so they often have to get up to go to the toilet more often. And interestingly, one of the benefits that we often find when we treat people for sleep apnea is that they don't have to get up to go to the toilet anymore. And that's often something that patients really like about having their sleep apnea treated. Medical illnesses and medications can also affect our sleep quality. So what do? We do hospital-based sleep studies in multiple different hospitals around at Cabrini, Southeastern, Epworth, and also in Gippsland at Maryvale. And we also do home-based sleep studies through Sleep-Life Balance. And this is at Bentley Specialist Centre when I got wired up to have a sleep study, and we videoed me being wired up for a sleep study, and the video's on YouTube if you're interested. And it's sort of, we use that to show patients what they're about to have to try and reduce the anxiety of going in for a sleep study, and to demonstrate that essentially what's happening is we're just getting a whole lot of leads and monitors and things stuck onto us to monitor what's going on through the night. And then, although we're wired up completely, expect people to go and sleep normally. The next thing is disorders of body clock. And this is really common. And I think that this is probably under-recognized as causing significant problems with sleep. And I think it's quite interesting too. So our body clock is essentially our circadian rhythm, which is an internal intrinsic body clock which modulates many physiological functions within our body, but it has a very strong control over our sleep and our wakefulness. And melatonin is the main hormone that's involved in our circadian rhythm, and melatonin begins to rise in response to dim light. So as light starts to get dimmer, we normally start to secrete melatonin, and it usually occurs about 2 hours before we go to sleep. This is also associated with a drop in body temperature, and our body temperature will gradually drop down throughout the night. And that's why having a room that's slightly cool is much more conducive to sleep than if the room's too hot and why we have difficulty sleeping when it is hot. And as it gets towards the morning, or in the morning, as we come towards the time when we're going to wake up, our melatonin levels naturally start to decrease and our body temperature starts to rise. And so we actually reach the nadir of body temperature about 2 hours before our natural wake-up time. That's often why if your natural wake-up time is, say, 7 o'clock, for instance, often you might wake up at sort of that 4:30, 5 o'clock time and feel quite cold. And as our body temperature starts to rise and our melatonin levels start to drop, that promotes wakefulness and helps us wake up. And there are lots of things that are controlled by our body clock. And interestingly, we're at our highest alertness in the morning, and that's important for kids. So, kids at school often do their maths and science before lunchtime, because that's when they're most likely to be able to concentrate the best. However, our best coordination and our best cardiovascular efficiency is in the afternoon. And our best muscle strength and cardiovascular efficiency is about 5 o'clock in the afternoon. And that's why a lot of Olympic records and world records in athletics and things actually occur at around that time in the afternoon. And so athletes love it when their events at that time. And the world record or the 100-meter sprints in the athletics is usually always in the afternoon. And so light is really important when it comes to our circadian rhythm, and bright light is the most potent stimuli of our circadian rhythm because it turns off melatonin secretion. But the effect of light exposure on our body clock is dependent on the timing of exposure. And this is quite important. I just explained that our nadir of body temperature, our body temperature gets to its coolest point about 2 hours before our natural wake-up time. If we expose our eyes to bright light after our body temperatures hit the lowest and is starting to rise again, then it will have the effect of moving our circadian rhythm earlier. So our body clock will be pushed a little bit earlier, and it'll encourage us to wake up a little bit earlier the following morning. If we expose ourselves to light before the nadir of our body temperature, so if we get up at, say, 3 in the morning and shine bright light into our eyes, then it actually has the opposite effect. It causes a phase delay. And so what that'll do is it'll shift our body clock forwards, and it'll make it more difficult to get up the next morning, because it'll make us want to sleep a little bit longer. So this is a problem. And so this is an under-recognized problem of people being on their phone at nighttime. Apart from the fact that it's not good for our mind, it's not good for relaxation, shining bright lights in your eyes at nighttime is not a good idea. And the most common disorder we see with regards to body clock is what's called delayed sleep phase circadian rhythm disorder. So it's when our sleep phase is delayed. It means that our body wants to go to sleep later, and it wants to wake up later. So sleep onset and wake times are later than what we would desire. And it's common, it's normal in teenagers. So the teenager who wants to stay up a bit late and sleep in, it's actually normal during teenage years for this to shift forwards a little bit. But if it shifts forward too much, or if it doesn't shift back again, it can become a real problem. The other time we see it is when people go from working their normal hours, and then they retire or they change jobs, and suddenly they don't have to get up early anymore, and they start sleeping in, and that allows their body clock to shift forwards, because our circadian rhythm occurs over a cycle of 24.2 hours. So it's actually not designed for some reason to be 24 hours. So what that means is that our body clock has a natural tendency to want to shift forwards. So if we don't hold it back, it's going to want to shift forwards. And people who are known as night people, who like staying up later and like sleeping in longer, they probably have slightly longer circadian rhythm, meaning they're always more likely to want to sleep later and get up later. So there's a natural tendency to always wake a little bit later every day. And so every day what we need to do is we actually need to adjust our sleep phase to accommodate this, and that's where light comes into it. So that's why it's so good in summer. When you wake up, you might wake up at 7 o'clock, getting ready for work. It's light, you get natural light in your eyes. It maintains your circadian rhythm. So the next day, you're going to wake up at the same time. And you're getting that light after your body temperature hits the lowest point. So it's at your wake time. So it's going to keep holding the body clock in the right position. And so what's the problem if this occurs? Well, it presents really in two ways. It presents with daytime sleepiness, and especially in the morning. And so if someone's natural sleep time, they naturally fall asleep at 2 in the morning, and they're naturally waking up at, say, 10 in the morning, then if they get up at 10 o'clock, they'll probably feel fine. If they have to wake up earlier than that, then they're going to be a bit sleepy. If they have to wake up more than 2 hours early before their body temperature hits the nadir of the lowest point, then they're going to feel terrible, and they're going to feel really sleepy. And not only that, it's going to push their circadian rhythm forward later. And so it's actually going to make the problem worse. So often these people present with daytime sleepiness, and the key to it is to ask what time they would normally naturally fall asleep, what time would they naturally wake up, and then when they're getting sleepy, what time do they wake up? And it's often, they're sleeping in often, but then when they have to get up for an early shift, or have to get up for a job interview, or have to get up to go to uni or something. The other way it presents is with insomnia. And so when someone says, I'll go to bed early and I just can't fall asleep, and I don't fall asleep until like 4 o'clock in the morning, and then I can't wake up in the morning. And the reason for that is because their body clock has shifted forwards. So their natural sleep time, their body will not allow them to sleep early. And what most people, the parents and the friends will say, why don't you just go to bed early? But going to bed early doesn't work because your body clock's not ready for you to go to sleep. These people, the other clue to this is that people often say, once you fall asleep, you sleep well. And you go, oh, in the morning, like I get my best sleep. Like I get up at 6, take the kids to school or something. I go back and I go straight back to sleep and I sleep the best ever. So the question is, when is your body clock actually wanting you to sleep? And if you did not have to get up for work, were on holidays, for instance, what time would you naturally fall asleep? And what time would you naturally wake up? And sometimes we can get a bit of a clue because if you've got an Apple Watch or a Fitbit, or it can give you a bit of an idea as to what time you're actually falling asleep and what time you're waking up. And sometimes it's useful to get people to keep a sleep diary. And so what do we do about it? So there are two options. We can either adjust your life to suit your sleep, or we can adjust your sleep to suit your life. And so if you're naturally falling asleep really late and getting up really late, and that fits into your lifestyle, you work an afternoon shift, for instance, then it's fine, it's no problem. But if you have to get up early, then it's going to be a problem. So you might have to adjust your sleep to suit your life. And so it's very common that we have to do that. And so the way to do it is actually to manipulate your wake up time. And so what you want to do is make your wake up time, set an alarm at your natural wake up time, and then bring that time forwards every 30 minutes. Bring it by 30 minutes every 4 days. And so what we're doing is we're making small changes, because if you make a big change, it's going to upset your body clock and make it hard for you and make it worse. But making small changes slowly will gradually adjust the wake up time, and your sleep phase will fall into place. The next thing, and probably the most important, is bright light exposure. So we need to expose our eyes to bright light between 40 and 60 minutes after waking up. And what that does is it's turning off the melatonin. So it's telling us this is wake up time now. This is adjusting our circadian rhythm, and it's pushing it back because the light exposure is timed correctly after an idea of body temperature. It's going to push up our sleep cycle earlier. And so as we do that gradually, we're going to wake up earlier. And so ideally, it would be wonderful to be able to go outside and go for a walk, because then you get the benefit of the exercise as well as the light from outside. Light just from inside isn't strong enough to be able to have an effect on our circadian rhythm. So the other option is you can get light glasses like this. So you can go about your activities of normal getting up and getting ready for work. You can even take these to work and wear them at work. And the other thing is we need to actually make sure that we avoid waking up early. And we actually need to avoid especially waking up just suddenly early, because that makes the whole situation much worse. And occasionally we'll use melatonin in the evening. And so the melatonin taken a couple of hours before sleep can sometimes help sleep onset. But the most important thing is manipulating the wake time. And if the wake time slowly adjusts, what will happen is that the sleep onset time will gradually become earlier. And so the last part is disorders of sleep habits, and which is essentially our sleep hygiene. So our habits of sleep and what we do around the time that we go to bed, because there's a vicious cycle of insomnia. And it starts off with initial poor sleep, which may be due to a stress, pain, medical illness, COVID, something that affects our ability to sleep or our quality of sleep. So we have a poor sleep, and then it can cause negative thoughts about sleep. So a few bad nights, we'll start to think, oh, I hope I don't have another bad night. I haven't been sleeping very well. And so you start having some negative thoughts about sleep, and that will cause anxiety and worry about not sleeping. You think, oh, I hope it's not going to happen again. And then people tend to try and improve the situation, but often through maladaptive habits, such as maybe taking a nap during the day. Oh, I didn't sleep very well, so feeling pretty awful. I'll just have a bit of a nap, and that's going to make it worse. The other thing that sometimes people do is they spend too long in bed. So they say, oh, I better not get up now because I haven't slept very well. I better make sure I get a bit of extra sleep. And so sometimes you find that people, if you ask what time they go into bed and what time they get up in the morning, they sometimes are going to bed really early, like 8 o'clock, because they're worried about not sleeping well. So they want to give them the most opportunity to get sleep. But then they're not getting out of bed until 8 o'clock. And so if you're spending 12 hours in bed and you only need 8 hours sleep, you're going to always spend 4 hours awake. And that 4 hours might be in the middle of the night, causing distress and things. So sometimes you actually need to restrict the time that you spend in bed so that it consolidates the sleep when you are there. And the other thing is a poor bedtime routine. And so if people develop poor bedtime routine, it can adversely affect their sleep, and that leads to continued poor sleep, that leads to more negative thoughts about sleep, and so on and so on. And we get a stressful situation that unfortunately becomes a bit of a vicious cycle. And so what we want to do is to, when we break this vicious cycle, and the way to do that is to cultivate these 6 good sleeping habits. And the first one is, as I've been talking quite a lot about, is maintaining a regular sleeping pattern. So we should ideally be falling asleep or going to sleep at the same time every night and getting up at the same time every night. It's not a great idea to sleep in on weekends, but if you do sleep on weekends, having an extra hour or 2 hours at the most is okay. But as soon as you go out beyond that time, it's going to affect your regular sleeping pattern. We need to create a bedtime routine. So we need to wind down to sleep. So I don't want to be exercising in the lead up to sleep. Ideally, we don't want to be on computers, iPads, phones, social media. All of these things affect the way we are able to wind down to go to sleep. Sometimes it's a really good idea to write a list of tasks for the next day. Apart from being a very good habit to get into in terms of work efficiency for the next day, it's really good just to get ideas out of your head, because often if you go to bed and wake up during the night, it might be because there are things on your mind, all these things I've got to get done, and being really busy, and concerns about everything that's going on, especially this year probably more than others, that suddenly don't occur when you're on holiday and your sleep improves. But when you are in a situation where things are really busy, writing down a list of things for the next day is really useful just to get them out of your head. Mindfulness exercises are really important and fantastic. Great for controlling anxiety, improving symptoms of depression, but very good also to help with sleep. And I recommend at the moment these 3 sites that maybe Leah can throw into the chat as we're going. And they also are all come on iPhone apps, and there's a free version of all of them. And I find them really useful just to sort of take you through sort of mindfulness exercises, especially in the evening as a part of that wind down can be really beneficial. And light exposure in the morning, which I've talked a lot about, is really important to help us wake up. And physical exercise, because if we spend the whole day working and we get mentally exhausted, if we haven't had any exercise, then sometimes getting exercise will certainly help us sleep by making us physically tired. And then what we need to do is we need to avoid these 6 bad habits of sleep. And the first one, and probably the most common these days, is the phone in bed. Used to be the TV in bed, now it's definitely the phone or the iPad in bed causes a lot of problems with people's sleep. And if you have any problems with sleep at all, if you have a patient that has any problems with sleep, I think the first thing you could do is just put the phone out of the bedroom. This is a major problem. It's not just a problem for your own sleep, but it's also not good for a relationship. I think we should try and improve our diet. Sugar is poison, essentially it's poison to us. It adversely affects your sleep because it causes a high rush, and then you have a dip in sugar. It's not good for you, and it's not good and conducive to sleep. And also we need to remember that although avoiding sugar is the most important, we should actually be avoiding carbohydrates altogether, because it doesn't matter whether you get the sugar in form of table sugar or chocolate. If you get the sugar from bread, rice, potato, pasta, brown rice, quinoa, superfood, it doesn't matter. It's all broken down in our body into glucose and has the same adverse effect on our body and can have the same adverse effect on our sleep. As I said before, we shouldn't spend too much time in bed. We should only really restrict the time in bed to time asleep. We should avoid daytime naps, because if you sleep during the day, it's harder to sleep the following night. And we should certainly avoid trying to avoid watching the clock. So it's useful if you're having an alarm clock to wake up, set your alarm so you know that you're not going to sleep in, and then cover up the clock so that you can't see the time. Because waking up and looking at the clock all the time just creates and adds to that anxiety of not being able to sleep. And caffeine and alcohol, if you're having problems with sleep, it's probably a good idea to cut out caffeine and alcohol, because interestingly, caffeine affects a lot of people's sleep. It's the most consumed socially acceptable stimulant in the world. It has an onset of action of 30 minutes. And so if once you have a coffee or some form of caffeine, it'll start having its effect in 30 minutes, but its half-life is 5 to 7 hours, which is longer than I think what a lot of people recognize. And so what that means is if you have a coffee at 1:30 in the afternoon, at 7:30 at night, half of that caffeine is still circulating. And so you might say, oh, but I don't have a coffee in the evening. But if you're having a coffee in the early afternoon, then it might actually still be having an effect on sleep. And to remember that caffeine is not just in coffee, it's also in other things, lots of teas, even decaf coffee has some caffeine in it, chocolate, energy drinks, Coke, and weight loss pills. So it's useful to think about that. And certainly some people are more sensitive to caffeine than others. Alcohol is interesting and affects our sleep in an interesting way. It certainly reduces our sleep latency. So everyone will know that after a few drinks, you fall asleep quite quickly. The first half of the night, your sleep is usually more consolidated. However, in the second half of the night, there's increase in sleep disruption. And there's also a reduction in REM sleep. And so often people find in the second half of the night, they wake up more often, sometimes have difficulty getting back to sleep. And it certainly adversely affects our sleep quality. And so people usually feel tired despite getting adequate amount of sleep if they've been drinking. So in summary, if there's somebody that has a sleeping problem, I think it's useful to think of it and contextualize it, is firstly to think about the quality of sleep. And if there's anything to suggest that there might be a problem with quality of sleep, then a sleep study is going to be really important, because improving quality of sleep is certainly the first step. You want to determine when your circadian rhythm is wanting you to sleep. And if your circadian rhythm is wanting you to sleep at a time that you're not sleeping, then you need to either change when you sleep or change your circadian rhythm. You want to identify and eliminate any bad sleeping habits and try and adopt more good sleeping habits. And so, my challenge to you, and this can be a challenge that you can pass on to patients, is to pick 2 of these things and commit to them for 2 weeks and see if there's a difference. So if there's a problem with sleep quality, if there's snoring, or if there's something else to suggest that maybe an adequate amount of sleep is still leading to daytime sleepiness, then the first step is to have a sleep study to make sure that the quality of sleep is good and that there's nothing that can be done to improve and optimize the quality. And then we need to think about these other things that will lead to improved sleep. And so maybe if we get back on the chat and maybe think just for yourself, is there 2 things in there that you think that you could do that could possibly improve your own sleep? And if you want to, just throw it in the chat there and we can see. Because I can certainly think that there's a few in there that would improve my sleep. I think that personally, I would do better if I was more regular with practicing mindfulness. I tend to go through periods where I do and then periods that I don't. And I also am usually quite good with that, with keeping the phone out of the room, but certainly fall into bad habits sometimes of doing that. The iPhone, yep, Leah. I've got a question there. I might just come back to that question. Increasing exercise, absolutely. Reducing caffeine. I think that's going to be a common one. A newborn, so most is out of my control, is absolutely true. That is going to make sleep very difficult, and certainly makes it for a difficult time with sleep. But I think interestingly, like the best way to, as certainly as kids get older, having kids that sleep well is obviously very beneficial. And the best way to get kids to sleep well is actually to create a really regular routine for them, and it's essentially following the same steps. And so what we need to do for our kids is sort of really the same what we need to do for our adult patients is the same as what we need to do for ourselves. Coffee, morning light outside, light exposure, eating chocolate, including 85%. That's true, right? But 85% is certainly better than the other chocolate, and that's certainly my preference as well. So there's certainly less sugar in the 85% lint than some of the others. So, but there is the caffeine in that too. Exercise, morning walk sounds good. Absolutely, if you've got time, if you're able to get out in the morning and get a bit of exercise and light, it certainly does make you feel very good. Excellent. So certainly sounds like everybody's got things that they could think about, things that could improve their own sleep. And I suspect that anything that you think that would help yourself will probably help patients as well.
Thank you very much, Barton. There is a few questions, so I might just go from the top. Um, Andrew has a question in regards to restless leg syndrome, and is that something that we would see, or is that neurology or someone else that you would refer to for excessive restless or difficult restless leg syndrome?
It's a good question, and I think that's an area actually there's a little bit of overlap between the sleep physician and also the neurologist, and probably I would imagine would probably be evenly referred because the treatment for sleep for restless legs is sort of treatments that the neurologists often use, and so the first step is clonazepam to settle down the legs, and if it's more severe, then we go on to Cifrol, which is essentially a dopamine antagonist, like a Parkinson medication. I think that if the patient usually presents with a problem with their sleep and their restless legs are playing a role, then it's probably something that a sleep physician would often see. But if it was causing more of the symptoms that are difficult to control, maybe that would be where the neurologist would be. And I know that I manage quite a lot of patients with restless leg syndrome and purate limb movements. And I sometimes, when they're really difficult to manage, or especially if they've got other comorbidities, like especially like say epilepsy or other neurological comorbidities, I'll certainly be keen to get the neurologist to see them. But I also get referrals from neurologists who say, this person's got restless legs, and our role will be to do the sleep study to see is the restless legs affecting their sleep quality, and is there something else that we can do for them? So it's actually a little bit of overlap.
Button, there's another question just around light exposure. So why is light exposure 40 to 60 minutes after waking? Is light straight after waking just as good?
Yeah. So the main thing with regards to timing of light is timing with regards to the nadir of our body temperature, which tends to be about 2 hours before our natural wake up time. So once you wake up, if you're waking up at your natural wake up time, then you want to expose yourself to light, whether that's immediate or after a period of time, it doesn't matter, so long as it's after that period of time. But say, for instance, you were going to travel overseas, imagine that, and you had to get up early for the plane. So your natural wake up time is 7 o'clock, and you decided that you're going to get an early flight. You have to get up, say 3 or 4 hours before your natural wake up time. So then you have to get up before your nadir of body temperature. The thing to do then is to avoid light. And you want to try and avoid light up until that time that would be at least 2 hours within your natural wake up time. And the other situation that we commonly find ourselves in, or we used to, is jet lag. And so jet lag occurs because we're flying into a different time zone where our circadian rhythm is not aligning to when we want to sleep. And so the best way to cope with jet lag is to try and get light exposure at the right time and avoid light exposure when we want to be asleep, so that we can get our circadian rhythm to realign to our new time zone. And if you're interested, there's actually a really good website where you can type in your time zone, where you're flying to, what time you're leaving, what time you're arriving. You put it all in, and it'll tell you exactly when to get light exposure and when to get avoid light exposure. And that website is called something Rooster. They'll come to me in a minute. It's called Sleep Rooster or Time Rooster or or something like that. I'm sure if you put Rooster into Google and circadian rhythm and jet lag, then you'll find it's a fantastic website.
Barton, there is just a question, there's quite a few questions coming through. So I'll just go back. Darren had a question just around the Medicare rebate for sleep studies that is not linked to high suspicion of OSA. And also, what is the cost of an unrebated sleep study? So it might be good just to comment around the process, I guess, and just making for sleep studies.
Sure. So Medicare will give a Medicare rebate for a home-based sleep study in a patient without having to see a sleep physician if the patient is at high risk for sleep apnea and also they're sleepy. So they've got the risk factors and they've got the symptoms. The risk factors can be determined by the OSA 50, which is the 4 questions based on age, sex, weight, and Epworth Sleepiness Score is the score that determines their sleepiness, and they need to score at least 8 on the Epworth Sleepiness Score. So if they fulfill those criteria, then GP or a non-sleep physician can organise a sleep study for that patient and get a Medicare rebate. If they don't fulfill those criteria, then they need to see the sleep physician first to determine whether a sleep study is necessary. And the reason Medicare have done this is essentially that people have been doing way too many sleep studies on way too many people, usually with the motivation of selling CPAP machines. And so if you want to sell lots of CPAP machines, you do lots of sleep studies, you find anyone with a bit of sleep apnea and try and sell them a CPAP machine. And so what Medicare are trying to do is just try and stamp out that sort of practice. So if, from a sleep physician point of view, like if we think somebody needs a sleep study, we don't need to fulfill those criteria. If a patient, the Medicare rebate for a sleep study is about $285. And so and from our point of view, our company called Sleep Life Balance, we charge the patients $100 out of pocket. So it's $385 because there's quite a lot of work involved, and we have a scientist that comes into the rooms and actually applies all of the leads. The patient goes home, then we have someone pick up the equipment, take all of the leads off, then the scientist has to sit through and go through 8 hours of data to score it. And then it goes to myself or one of our other sleep physicians to go through all the data again and put together a report. So it's actually quite a time-consuming sort of thing to do.
Barton, we've got another question. Thank you, Ron. It is jetlagrister.com. Thank you for that.
Excellent.
Ron also had a question around early morning waking and feeling very tired, like being run over a bus. It says, I think it's 5 a.m. That we're talking about, but not being able to get back to sleep, but has only had 5 or 6 hours sleep. And I guess, what are your thoughts around that, Barton?
So waking up early and then not having difficulty getting back to sleep.
Yes, but not only having 5 or 6 hours sleep.
So the first thing to do is to make sure there's not something causing that wake up at that time. So, for instance, there's not sleep apnea, that there's not that it's getting up to go to the toilet that's causing the wake up. If there's not something obvious that's causing the wake up initially, then another thing that commonly occurs is that's when we tend to wake up with stuff on our mind. So if it's waking up and there's the mind spinning and that's what's causing difficulty getting back to sleep, the things that can be done about that is the mindfulness, especially in the evening. And sometimes if it is the mind that's racing at nighttime, sometimes what is required just to get back to sleep is something just to take your mind away from it. And that's when sometimes I'll just put in on a podcast of a radio show that I'm not that interested in, or something that's not going to create too much interest, so I'll intently listen to it. Something just that, or some sort of noise. Sometimes people find music useful, but it's just something that just takes your mind away from the racing thoughts that's going on, keeping you awake. The next thing is to think about, the sleeping time. So am I going to bed at the same time, getting up at the same time, and making sure that we're not spending too much time in bed, because if there's adapting by too much time in bed, then there's always going to be a bit of time waking up at night time. The other thing to think about, when people do wake up at night time and have difficulty getting back to sleep, and sometimes people will say to you, I wake up at night time and sometimes I don't go back to sleep at all. I'll lie the whole night awake. But then those people sometimes don't get sleepy during the day. If people are not sleepy during the day, it tends to suggest they probably are getting enough sleep. And there's a thing called sleep state misperception. And sleep state misperception is when you sort of perceive yourself to be awake, but you're really asleep. And it partly occurs because time spent awake tends to go much slower than time asleep. And so if you drift in and out of sleep, you perceive that you've slept for a very short period of time and you perceive yourself to be awake for a long time. And the other thing is that we can actually drift into sleep, sometimes even deep sleep and REM sleep, and then drift out of sleep and not actually realize that we've gone into sleep and out of sleep. And sometimes when we do sleep studies on patients, they'll say, I didn't sleep. I guarantee you, I did not sleep. And the EEG shows that, you went into all stages of sleep, and people are sometimes really quite surprised by how much sleep they actually got. And I think that the useful thing about recognizing that is that sometimes when you do wake up and you're lying there and you think it can be frustrating that you can't get back to sleep, sometimes just lying there and relaxing as much as possible, listening to something, taking the mind off it, maybe practicing some mindfulness at that time, and just realize that, I am probably going to get some benefit from just lying here. I may be drifting in and out of sleep more than I think I am, and to try and just relieve that sort of anxiety and annoyance of being awake.
Barton, we've got a couple of questions here which would be worth you commenting around insomnia in elderly patients being quite common, and is it usually related to an altered circadian rhythm, medication, sleep apnea, anxiety? How do you assess insomnia in elderly patients? And can you perhaps just make a comment around your thoughts on long-term sleeping tablets in elderly?
Well, I think the assessment is sort of the same. I think we should sort of go through the same process. There's certainly often elderly people do have trouble with their sleep. Sometimes they don't need quite as much sleep. Often I find elderly people spend more time in bed, and some of the time is because for that reason they think, oh, if I spend longer in bed, I'll get more sleep. Or if they're a bit socially isolated, then sometimes people go to bed early and spend a long time in bed. And if you spend a long time in bed, then you're always going to spend some time awake. I think anxiety and depression are really common in the elderly. So trying to manage those things, and especially at the moment, I've noticed this year, and I'm sure everyone else has noticed this with elderly patients this year, have really suffered from COVID lockdown. Well, they haven't suffered from COVID, they've suffered from the lockdown, because the lockdown has affected the elderly, because when they might have had 2 or 3 social events throughout the week, and those have been taken away from them, or they might have caught up family with once or twice a week with grandkids and things, then suddenly that's been taken away. And I think that the elderly have really suffered through this time. And I think that will certainly cause problems to their sleep. So I think trying to manage those things is going to be really important. Otherwise, I mean, the assessment is really about the same things, looking at the body clock, looking at the sleeping habits, trying to avoid the bad habits and cultivate the good habits. Sometimes elderly people, I spoke today about a delayed phase circadian rhythm where we fall asleep later and wake up later. Sometimes you can get the circadian rhythm moving in the other direction, and that's called an advanced phase circadian rhythm disorder. And so when people fall asleep really early, so they can't stay up late, they fall asleep early, but then they wake up early in the morning. And so this is more common in the elderly. And so it may be that they've got a circadian rhythm disorder as well. And so the management, if your circadian rhythm has moved the other way, is to have light in the evening, gradually getting later, to try and push back the sleep time to allow to sleep in a bit longer in the morning. Having said that, I always say to people who have this, and the elderly patients, well, does it worry you? Like if you're going to sleep at 8 o'clock and getting up at 4 in the morning, and you're happy just to wake up and read the paper and lie there and do whatever, if it's not causing distress, it's fine. There's no need to try and alter it, because sometimes altering it can make it more difficult than just learning to accept it and live with it. With regards to sleeping tablets, that's a good question. I really try and avoid sleeping tablets. I think that sleeping tablets play a role in the short term to get things back on track. If someone's having a bit of a stressful time, certainly, and having poor sleep, feeling lethargic, sleepy, and feeling terrible, certainly like sleeping tablets for a few days or a week to get things back on track to help people feel better is certainly a good idea. But I don't think it's ever a good idea in the long term. Having said that, if I see someone who is on a sleeping tablet, especially in the elderly, and they've sometimes been on their Xanax or their Seropax or whatever it is, and they've been on it for a long time. If they're not increasing the dose, so they're not getting tolerance and increasing the dose, if they're not getting side effects, then I can't see much point in changing it. In younger people, I think it's worthwhile trying to change, and certainly just doing everything slowly is the key. So just gradually, slowly reducing the sleeping tablets. And I think the way to get people off sleeping tablets is to go through the process of improving their sleep and then get them off the sleeping tablets. So you make sure there's no sleep apnea, make sure sleep quality is good, align their body clock, get them doing all the good habits and avoiding the bad habits. And once they're doing those things, then to gradually wean off the sleeping tablets.
Barton, I'm just conscious of time. We've got a couple of other questions, which I will get you to comment on quickly. One of them is around, obviously it is a double-edged sword, using sleep meditation apps from phone sleep. But there is a comment around blue light filters on phones.
Yeah, well, it is a double-edged sword, isn't it? Because I think that, and I think that actually plays a role in my own reason for not having the phone outside. I think that I probably should leave my phone when I'm not on call out of the room. But part of the reason I don't is because I do use the meditation apps in the evening, and if I do wake up at night time and I've got things on my mind, I'll put in a headphone and listen to some music or an app. So that certainly is a bit of a double-edged sword, whether you can use something else to listen to or something like that, or have the ability just to make sure that you're not looking at Facebook, the newspaper, Instagram, and those things that are causing the problems would be important. But that is very true. And phones do have like the changes the light filters and things to try and reduce the effect of light on our eyes at night time. And that's great and that's useful and things, but you're still shining light in your eye. And there's been studies on blue light filters and things like this, and it's all very good theoretically, but the evidence is not strong. And I think it's something that the phones are using to try and tell people that they're okay to use at night. It may be better than just shining the non-filtered light straight in your eyes, but you're probably way better off not shining the light in your eyes at all.
And Barton, I've just got one more here from Anna in regards to, it's just slightly confused around what is the latest time of day for exercise for it not to affect your sleep? If 5 p.m. Is best for muscle activity, when is it best to stop?
That's a good point, isn't it? Muscle activity is best in the late afternoon. When should we stop? Well, I think it probably is individual. And it probably takes between half an hour for our body temperature to cool down and for us to be able to go to sleep. So I would have thought at least an hour, but it's probably individual. And so if you're finding it's difficult to get off to sleep and you're exercising in the later afternoon, then maybe you need to bring it earlier or see how you go without that exercise. But if you're exercising in the afternoon and coming home and going straight to sleep, then that's certainly fine. If there's not a problem, then that's fine for you. But I would have thought probably at least an hour or so.
And Barton, we've got one last question here in regards to sleep studies and what percentage of diagnosis is a movement disorder versus circadian rhythm disorder versus sleep apnea?
So I think sleep studies are diagnosing sleep apnea, by far the most frequently, and it's probably the most frequent reason to consider doing a sleep study. Leg movement disorders or leg movements we often see on sleep studies. And so very frequently when we look through a sleep study, we'll see patients that are rhythmically kicking their legs. The question is whether we need to treat that or not. And most of the time we don't need to treat it. Because if it's not causing a problem, then we don't need to treat it. If it's occurring as well as sleep apnea, then I would always treat the sleep apnea first, because treating the sleep apnea will have a greater positive effect on sleep quality, and often the leg movements settle down after the sleep apnea is treated. If there's no sleep apnea or the sleep apnea is treated and there are still leg movements and the patient is symptomatic, so they're getting symptoms of the restless legs, they're annoying them in the evening, they're having to move around, or they're kicking their legs a lot and they're getting sleepy, then certainly treating the leg movements would be the right thing to do. And then less commonly, we see things like bruxism, teeth grinding. Circadian rhythm disorders, we can't really pick up on a sleep study, except sometimes if someone has a home study, you can see what time they fell asleep and what time they woke up. And so when patients are in the comfort of their home and they're allowed to sleep whenever they want, sometimes you'll notice that, you didn't fall asleep till 3 o'clock in the morning and you slept in for quite a long time. Maybe that suggests that that's what their sleeping pattern is. And we get a bit of an idea from that, as opposed to the sleep lab where you put in a certain time and you're woken up at a certain time. But people never get the best night's sleep when they have a sleep study, and that doesn't matter. We're not trying to work out, what's optimal, what's a normal best quality sleep for you like. We're looking to see what's sleep quality like when you're asleep. Are you waking up frequently throughout sleep? And is there something there that's clearly interrupting sleep quality?
Great. Thank you very much, Barton. I think we have answered most of the questions there. If you do have any further questions, please feel free. We will hang around for the next 5 minutes. So if you've got any further questions, please feel free to just pop them in the chat, and we will unmute everyone, and you can have a chat. Young kids, yes, wow, I can still hear ours upstairs. Still awake. We could perhaps practice some of these things tonight with them. But thank you very, very much to everyone for tuning in tonight. This is our first GP event, and we are hoping to hold them again more regularly in 2021, so the new year. So if you are interested, we'd love to have you come back and join in with us again. Alternatively, if there is also topics that you're really interested to hear a little bit more about, please let us know. Send us an email, get in contact with Barton or the practice directly, and we will try and accommodate. We're also hoping next year to have a Q&A session, so you've got an opportunity to speak with Barton and ask anything in particular that you have. But on behalf of Lung and Sleep, thank you all very, very much for coming, and Merry Christmas, and have a great 2021. We look forward to seeing you all next year. Thanks, guys.
Thanks, Leah.
Thanks,
and thank you, everyone, for coming along. Thank you for your kind messages. Thank you. Hopefully it's useful and a bit of fun, and nice to have a bit of a chat.
Lovely. I will try
Very
and
kind.
mute everyone there.